Good morning. Let's do a test. It is another new setup. Testing, testing, testing. Okay, I think it's working now. Good morning. Today is Saturday. It's June 11, 2022. Today is our regular yoga therapy classes. So, we have been discussing last time yoga therapy, finding the center. Basically, what we have shown that health is defined as a balance of your body, mind, and spirit. The definition of yoga, the root word comes from yog, which means union of your body, mind, and spirit. It is also the union of Jiva Atma. Jiva Atma is individual soul to Paramatma. Paramatma is universal soul. It is the union of individual soul with the universal soul. It's a spiritual definition of yoga. Yoga as a therapy is the philosophy. Yoga Sutra of Patanjali, 196 sutras, of which 193 are to quiet down your mind. There is an 8-limb practice called Patanjali Ashtanga Yoga, Yama, social restraint, Niyama, personal restraint, Asana, external and internal alignment, Pranayama, voluntary regulated breathing, Pratyahara, control of your 5 senses, Dharan, focus, Dhyan, meditation, Samadhi is the union of your body, mind, and spirit. So our whole practices, starting from all the social and personal restraint, physical asanas, breathing, pranayama, all leads to the meditation, which is the 7th limb, and beyond that is the samadhi, which one is the union of your body, mind, and spirit. Finding center in mental and spiritual wellness is basically connecting your individual soul to universal soul. It is introspection, looking inside you, and the self-realization. So today's practice, we're going to show you the pranayama practices which leads you to your pratyahara control of your senses. Pratyahar. Pratya means reject. Ahar means all the input. Eating is not only the input. We have 5 senses. We hear, we see, we smell, we taste and touch. All the inputs are also our intake. Leads you to the focus, the dharan, then the meditation. In the meditation practice, we'll be doing a balancing meditation practice, and that will be your leading to finding the center. As we've shown in our physical asana practice, that balancing both sides of the body equally will activate both the right and left half of our brain. We are all lateralized. I'm either right-handed or somebody is left-handed, but none of us are equal on both sides. Shabboshachi. So, in pranayama, you will see that we start doing our voluntary regulated breathing. Then, in a pranayama practice, it will also activate both sides of your brain, like your alternate nostril breathing, and also your bellows, Bastrika, Kapalbhati, breath of fire, alternate nostril breathing, Anulom Vilom Pranayama, then bumblebee breathing, Brahmri Pranayama, Ujjayi Pranayama, and the Om Pranayama, all are going to lead you to your finding the center, basically your union of your body, mind and spirit. I'm getting some signals. Let me see. Okay. So, let's start the asana practice which we did last time. Basically boils down to one asana. It's called Sthiram Sukham Asana. Sthiram is a stillness, Sukham is a happy, Asana is a pose. Okay, let me go to a chair. Let me sit down in a chair today, and I'll be doing today's session on the chair, because everybody comes to me and said, I cannot get down into the ground. So start in a chair. Start laying down in your bed. Start standing up. Start where you are. It is non-competitive. You don't compete with anybody. Listen to your body's signal. As I'm always emphasizing, no pain and effortless breathing. If you progress with the no pain and effortless breathing, you will develop that neuroplasticity, and in stages, impossible become possible. So, the basic requirement to bring the relaxation response in your body and mind, it starts with keeping your spine straight. We call it a Meru Danda Achala. So we keep when you sit in a chair, what you need to do, you need to go all the way to the back So let me adjust one thing. You will be sitting down at the back of the chair. Any chair you sit down, then you keep your spine straight. Merudanda Achal, and there is your Manasthir. Manasthir will come with your practice, which you'll be doing slowly and slowly. Hand connects your body and mind. Hand gesture called mudras, and you always use the mudras to quiet down your mind and also doing pranayama practice. And always at least we all try to do our practice with a health tracker. Here I have an Apple Watch. I have all my health parameters here during my practice. Manasthir, stillness of the mind, comes when you are able to quiet down your five senses. Mind in yoga is described as the content of your five senses. When your five senses are in the balance, five senses are in the control, your mind is control. So use a Dhanu Mudra or a Jnana Mudra. Touch the tip of your fingers, index finger and the thumb, and bring it slowly close to you over your knees. Sorry. All the way to the back, spine straight. Touch your index finger and thumb, put it over your knees, then close your eyes. Vision is the most powerful of all the five senses. Another interesting phenomena is, out of all the five senses, the hearing is the last sense to go away. We have noticed people can control their vision, smell, taste and touch, still have their hearing. We have also noticed in a patient, the patient undergoing anesthesia, they have induction of the anesthesia, they being even a respirator, but they still can hear. You have a lot of interesting stories about a patient in the operating room under anesthesia has heard the conversation in the operating room. Next, bring your attention to your breath. Breath is also the connector between your body and mind. As I always say, metaphorically, if you're flying a kite, if the roller in your hand is the body, the kite is the mind, the thread connecting the roller and the kite is your breath. Breath is the connector. Lung is like a balloon, the 6-liter capacity, it needs 1.5 liter to keep it inflated. We have 4.5 liter of the air which you can exchange. That is called a vital capacity. Normally we only breathe 500 cc in a normal, called a tidal volume. You have to learn how to empty this balloon before you can develop any monastery, quieting down your mind. Best way to do is you do a very slow and long breathing out. Remember one thing, the way to practice pranayama is to learn how to extend, how to slowly extend the exhalation longer than slow inhalation. When your inhalation and exhalation becomes longer and longer, it reduces the rate of respiration. Very simple calculation is our normal breathing rate is between 15 to 16 per second per minute. We can easily do 4 seconds out, 2 seconds in, and if we keep on practicing it for a while, a neuroplasticity will set in after 20 to 40 input, and my breathing rate will drop down to 10. Because 4 seconds in, 2 seconds out is 6 seconds, is the respiratory cycle. We've been doing it for long enough, we can easily do it almost 10 seconds in, 20 seconds out. Let's do a first pranayama practice, how to extend your exhalation. Spine straight, mind quiet down, eyes closed, hands in a meditation mudra. Breathe out first, effortlessly, as long as you can. You can very easily do 4 seconds out. 1 and 2 and a 3 and a 4 out. Then 2 seconds in. 1 and 2 in. 4 seconds out. If you're practicing with me, please practice. And in a short time you'll see you'll be able to do it completely effortlessly. If you have any effort, this pranayama is not going to have any therapeutic effect. Effortless breathing means the breathing feels like your normal breathing. You will be able to talk, you'll be able to sing, and you will see there is a saliva in your mouth. Saliva in your mouth means you are having a parasympathetic activation. We've been doing it for so long. Let me show it to you just for a sample. I can do very easily 4 seconds in, 8 seconds out. Breathe out first. Four seconds in. 8 seconds out. Practice it. Practice it. The moment you keep on practicing, you will be breathing like that even when you are sleeping. I always say, now if you look at a baby, baby does abdominal breathing. Abdominal breathing is parasympathetic. And baby always, if you look at a baby's breath, exhalation is longer than inhalation. Another example, let me show it to you. 8 seconds in, 16 seconds out. Breathe out first. When you do this breathing, it always, the air goes through your larynx and it always stimulates your vocal cord and the area of cough reflex. So little cough during your pranayama practice is entirely a normal phenomenon. Once you prepare your lung for your pranayama practice to bring the center, like you have to be in the center. The first pranayama, the centering, is your Bastrika Pranayama, which is the bellows. Bellows is the that you are using, in a countryside, they're using it for blowing your fireplace or blowing your blacksmith. Used to do it, but they don't do it anymore. It's all electric. I have a real bellows. A friend of mine gave it to me, and I show it to you all the time. So bellows is basically you're breathing, air in, then let it go. So the way to practice to bring the balance is doing the same way and then also opposite way. So here I am, I'm going to do a bellows practice, Bastrika, with the inhalation and exhalation. So what I did inhalation in the front, exhalation on the side. And I'm still breathing normally, I'm effortless, and it is totally, I feel like it is my normal breathing. Now I can do the same thing. Now we'll be doing breathing in here, breathing out. You can continue until you have an effort in breathing. Generally, we continue as long as we can. And we slowly build up our neuroplasticity and our effortless breathing. The hand mudra, called Adhi Mudra, or called a baby fist, Balo Mushti Mudra, putting a thumb inside and closing your hand. Thumb inside, close your hand, it relaxes your whole body and mind. Next thing you do, the little balancing practice, is a very rapid Bastrika Pranayama, and when you do with your eyes closed, in a short time you will see you will be entering into a transcendental state. That's where the name came from, the transcendental meditation. Pranayama leads you to the next subsequent limbs or stages, pratyahara, dharan and dhyan, the meditation. When you enter into the transcendental state, you have even no idea where you are, you have no idea what you're doing. Your individual soul is connected to the universal soul, and you are finding your center. Let me show you the practice, and if you are with me, you can do with me. It will be a wonderful practice for your health and wellness. My lung is completely empty. I'm still in an effortless breathing. I'm still talking, singing. I had no connection with the outside world. My eyes were closed. My concentration was on my breathing. And since I practiced for a long time, I knew exactly, I did about 600 of this rapid Bastrika Pranayama. A lot of question will come. People who understands the regular yoga practice will say, don't do a fast pranayama. Pranayama is dangerous if you do without a guidance. Bottom line here is, as long as you are effortless in your breathing, as long as there is no pain, as long as there is no unexpected symptoms except symptoms of hyperventilation, altered sense of consciousness, circumoral numbness, carpopedal spasm, the whole rapid Bastrika Pranayama causes cerebral vasoconstriction. What does it mean? It constricts, that it tightens up the blood vessels going to your brain. Brain does not get enough blood supply, so this hyperventilation syndrome gives you an altered state of consciousness. A lot of psychiatrists uses this phenomena, and there's a lot of different names of it, but basically it's a hyperventilation syndrome. And you will see a lot of practices. Sudarshan Kriya from Art of Living, if you see the practices, it is basically your hyperventilation syndrome from rapid Bastrika Pranayama. It does take you to a center, it does take you to your introspection and self-realization. Self-realization basically means real eyes. The eyes are now turned backwards. Instead of looking outside, you are looking inside yourself and trying to find it out that I am the cause and I am the cure. I created all the chronic endogenous diseases on me, and I'll be the only one who will be able to take care of it. Kapalbhati Pranayama. Kapal is the forehead, Bhati is the shining. We have a balloon here, we have a diaphragm here, another balloon here. We squeeze and push your belly button to the back to squeeze the balloon. It hits the diaphragm, it hits this balloon, air comes out, and it is an active exhalation, passive inhalation. In a short time, it leads you to the state of transcendental state, the center. We do with all the mudras, Dhanu Mudra, Ganu Mudra, Purina, Vayu Mudra, Shunya Mudra, Prithvi Mudra, Varun Mudra, Shakti Mudra, Apna Mudra, Apna Vayu Mudra, Linga Mudra, Ganesh Mudra. So, but here, for finding centers, you do it Ganu Mudra and Dhanu Mudra. I will keep on doing this pranayama. If you're doing with me, please keep doing it very slowly, 1 per second. Keep your spine straight. Put both the hands over your knees with a Dhyana Mudra or Jnana Mudra. Close your eyes. Bring the awareness to your belly button. Push the belly button to the back. Air will come out through your nostril. If you're new to the practice, you can put your one hand in the belly button, other hand under the nostril, and you push it in, you'll say air will come out. A lot of newcomer comes and tells me, I cannot do it, I cannot coordinate. Our approach is, tell the person, can you cough? Okay? Cough in front of me. So they'll cough. It's great. Why don't you try to cough with the mouth closed? It becomes a Kapalbhati Pranayama. Let's keep on doing it. Very slow, 1 per second, eyes closed, spine straight, and see the effect of it in your body and mind. And I will also tell you the physical benefit of this pranayama. Don't stop it. I might stop it when I was explaining, but you continue. You continue, let me explain. It also massages your intra-abdominal organs, organ inside your abdomen. After your vital function, most of the chronic diseases comes from the organ inside the abdomen. This is also called Udar Karshan. Udar is the abdomen, Karshan is the massage. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine, massages your lower part like rectum and anal canal, massages your bladder. For the women, it massages your uterus, massages your tubes, massages your ovaries. For men, it massages your prostate gland. In yoga therapy, when you massage the organ, its function gets better. We have a lot of examples. The infertile couple doing Kapalbhati Pranayama, massaging uterus, tubes and ovaries, became pregnant again. Massaging the pancreas. It's like stimulating the beta cells. Making more insulin, controlling diabetes. It massages your diaphragm. Above the diaphragm are the 2 lungs. Massages the lungs. Removes all the toxic air which are trapped inside your lung. I'm not breathing in, I'm only breathing out. I'm breathing in passively, subconsciously, without knowing. You don't need to learn how to breathe in. The day you are born, you learn how to breathe in. You practice breathing out. Between the lung is the heart. It also massages the heart. Very slowly it massages the heart to improve the heart function. It is almost like your CPR, cardiopulmonary resuscitation. When the heart stops, we do the chest compression to massage the heart. This pranayama massages the heart from inside. We call it an internal CPR. It ignites your digestive fire. Digestive fire is called Jathar Agni. Improves your digestion. Whole digestive tract is supplied by parasympathetic nerve. It also stimulates parasympathetic nerve by massaging the right and left vagus nerve, which are in front and the back of your gastroesophageal junction. It ignites your Agni, the fire within you, and creates your Tejas, Prana, Teja and Ojas. When you continue the Kapalbhati Pranayama for a while, you enter into the transcendental state, you ignite your Tejas, looks like you are glowing, and that's where the name came from. Looks like your forehead is shining, and there is a little lamp or a fire around your face. When you're practicing pranayama, when you are in the center, people will definitely notice. People will come and say, you are literally glowing. Let's continue for a short time, see how it affects your body, mind and spirit. When your focus is in your belly button, slowly and slowly the focus gets defocused. Dharan, the focus, and enters into a defocused mind, which is a meditation. In the meditation, you have the thoughts, but the thought gets into file in a folder. All of your thoughts, we are generating thousands and thousands of thoughts. Majority of them are in the past, rest of them in the future, very little in the present. But the thoughts in the present are also repeat thought process. In a meditation, you enter into the thought process and you enter into the gap in between the thought process. Start increasing the gaps. You still don't have the thoughtless mind. You still have the thoughts, but there is no repeat thoughts. There is no monkey jumping in your mind. Mind was like a fall, Niagara Fall. It becomes like a river, becomes like a pond. You can clearly see the stillness of the water in the bottom of the pond. Alternate nostril breathing takes you to a complete balancing of both sides of the brain and enter into the center. Anulom Vilom Pranayama, which is then incorporates into your breath holding or kumbhaka. Both of your nostril is not always open all the time. You're practicing with me, you can practice. Close your right nostril, breathe in and breathe out through your left nostril. Close your left nostril, breathe in and out to your right nostril. My left nostril is more open than your right nostril. Alternate nostril breathing will open up your both the nostrils. Throughout the whole day, you continue with your alternate nostril breathing. Left hand to use a Dhyana Mudra or a Ganu Mudra, put it over your knees. Right hand, close your right nostril with your thumb. Breathe out through your left nostril, keep your eyes closed. Breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Always breathe out longer than breathing in. Breathe in through the right nostril. Close your right nostril, breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Keep on doing it, and let me tell you how it brings to your center. Left nostril is controlled by your right brain. Right brain is female, right brain is intuitive, right brain is cooling, right brain is parasympathetic. Left nostril breathing is called Chandranari, moon energy, parasympathetic. I already can see my right nostril is more open now. Right nostril is controlled by the left brain. Left brain is male, left brain is analytical, Left brain is heating, left brain is sympathetic. Right nostril breathing is called Surya Nadi, sun energy, sympathetic. Many a time you'll see your elbow is going to drop down because cannot keep it up. Many a time when I'm sitting in the ground, I put it on a small stool, or I use my left hand to use it as a support. Next, I create a Vishnu Mudra. Use your index finger and middle finger, put it in between your eyebrows, the third eye. Your eyes are already closed. Bring your awareness into third eye and continue alternate nostril breathing. Then bring the more balance back. You go to your super brain yoga. Have your left hand hold the right earlobe. It is the crossing the path of your both sides of the brain. You keep on doing your alternate nostril breathing until you have some effort. Normally when we practice as effortless, we do generally between 5 to 10 minutes of alternate nostril breathing. If you keep doing it, in a short time you'll see you will enter into a transcendental state. You will have no idea, you have no connection to outside, you have no idea even what you're doing. Wonderful practice to find your center. At home, keep doing it, so you'll see the effect of it. Now incorporate a little bit of your kumbhak, the breath holding. In yoga, inhalation is called purak, breath holding is called kumbhak, breath holding in inhalation is called a abhantarin kumbhak, exhalation is called rechak, and breath holding after exhalation is called a Bajju Kumbhak. Use a Vishnu Mudra. Drop your index finger, middle finger. Have a pinch with your little finger, ring finger and thumb. Put it over your nostril. Breathe out through your nostril. And generally we use a ratio is 1:4:2. We'll do a 4-second in, 16-second hold, 8-second out. I'll just do another practice and then you can increase it. Same ratio, 5-second in, 20-second hold, 10-second out. I'll just show you as a technique, then you will continue home at your practice, Nadi Shuddhi Pranayama, the channel cleansing pranayama. Breathe out through your left nostril. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out to the right nostril with a count of 8. Breathe in through the right nostril with a count of 5 in. Hold your breath for count of 20. Breathe out to the left nostril, count of 10. Wonderful practice, Nadi Shuddhi Pranayama. Very soon you will enter into your transcendental state. Breath holding after inhalation is called a herring brewer reflex. It is the activation of your vagus nerve, vagal tone. All the discussion about polyvagal theory and yoga is all being described in our Yoga Shastra for a long, long time back. It's the activation of the vagus nerve and relaxation response. Bhramri Pranayama, bumblebee breathing, shut down all of your 5 senses, create a vibration which is the same vibration of your brain. 2 vibration interacts, cancels, called a harmonic resonance. And your mind quiets down, manasthir, enter into a state of meditation. Index finger in the forehead, use your thumb to close your ear, put your 3 fingers to close your eyes, close your mouth. You breathe out through your nostril, breathe in through the nostril, breathe out with the sound of a bumblebee. One more time. And slowly do your humming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, then remove your glasses. Take the hands like a cup, put it over your cup, put it over your eyes. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face. All the muscles of the face are attached to the skin. When the muscles are relaxed, all the lines goes away, all the frowning goes away, and the skin becomes a lot more smooth, all the wrinkle goes away. Take your hand, massage the earlobe. This is called the auricular branch of the vagus nerve. Massage in the back of your ear, front of your ear, inside the external ear canal, where the auricular branch of the vagus nerve is. So the vagal stimulation. Bring your hand, massage both sides of your neck, which is called a carotid sinus massage, which causes relaxation of the whole cardiovascular system and nervous system. The hand to the back, massage in the middle of your back with the insertion of your sternomastoid muscle and trapezius muscle, which is supplied with a cranial nerve. In a regular practice, we generally do about 7 to 10 Bhramri Pranayama. Ujjayi Pranayama brings you to the absolute, and during Bhramri Pranayama, within a short time, you will have no idea even where you are. What I do most of the time when I'm doing with a large participants, and I continue, I keep an eye on them, and they have no idea what they're doing. One of them will go for a long time, one of them doesn't know what they're doing, It is totally a transcendental practice. Ujjayi Pranayama, slowly constrict your larynx in a relaxed way, no tightness. Breathe in slowly through like a straw. And in yoga therapy, we do it very tight. And then we incorporate breath holding in inhalation. Jalandhar Bandha. And finally, we include left nostril breathing, Chandravidhi Pranayama, all activation of the relaxation of the parasympathetic tone and bringing the center. I still have a little bit of throat, as I told you last time. After my second COVID booster, I started developing a laryngitis. My voice was hoarse and I had a chronic cough. It's almost a month. Still is not clear yet. So let me give a try if I have a little cough, because cough comes from your larynx where you are originating your Ujjayi Pranayama. Again, hand, I like to do it in the Adhi Mudra, it's a relaxation. Breathe out first. Take a deep breath in. Completely breathe out, squeeze your larynx and breathe in. Wonderful practice. Ujjayi Pranayama with a chin lock, Jalandhar Bandha, and left nostril breathing. Combination of three literally takes you to your transcendental state. Breath holding in inhalation with chin lock. This is so relaxing, so centering. It is called a Murcha Pranayama. Murcha means unconscious. You feel like you're unconscious. Breath holding in exhalation and hold the breath, called a Bajra Pranayama. That is called your Uddiyana Bandha, out of the three locks. Chin lock, Jalandhar Bandha, Uddiyana Bandha, abdominal lock, and then the Mula Bandha, the root lock. But all the three is called a great lock or Mahabandha. Breath holding in inhalation with chin lock. Breathe out first. Take a deep breath in. Hold your breath. Drop your chin down. Touching your chest wall but not bending your knees. And keep counting how long you can hold your breath. Like this. 1, and a 2, and a 3. Just keep doing it with me. Say how long you can hold it without any effort. This is called Murcha Pranayama. From unconscious. You feel like you are totally in a transcendental state. Uddiyani Bandh, Vajra Pranayama, breath holding in exhalation, which is also called a suspension. All yoga practice, breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. All of your breathing does through your nostril, through your larynx. Breath holding in exhalation, Vajra Pranayama. You can also incorporate this called a Sabithy Pranayama. In Sabithy Pranayama, you do a ratio of inhalation, breath holding, exhalation, breath holding. If you create a simple ratio, there is no hard and fast rule. You can do 1:4, 2:2, and whatever you can do without any effort will be perfect. We really recommend Sabithy Pranayama, people who just started the pranayama practice. In a Uddiyani Bandh, abdominal lock, it creates a negative intra-abdominal pressure. Perfusion of the intra-abdominal organ gets better. People with hernia gets more effect with a positive intra-abdominal pressure. We ask them to do Uddiyani Bandh, creates a negative intra-abdominal pressure. Chanting is called a mantra. Mantra, man means mind, tra is the carrier or the vehicle. Mantra is a frequency which has the same frequency as your brain. Two frequency interacts, creates a harmonic resonance, and cancels the brain. We all practice Om Pranayama. Om is a sound of primordial sound which has a same frequency as the frequency of your brain. Om has three components: A, U, Ma, A, U, M. A comes from the lower part of the lung. Ma comes from the middle part of the lung. A, U, Ma comes from the upper part of the lung. You can incorporate this three sound with the three breathing, with the hand mudras, that is called a Pranabho Pranayama. Pranabho Pranayama also takes you to the center. So in a simple Om Pranayama, what you do, you extend your exhalation as long as you can and continue your Om. Then I'll show you your Pranabho Pranayama. Hand in that Dhanu Mudra. Breathe out first. You'll be taking a deep breath in and breathe out with the sound of an Om. In a Pranava Pranayama, we use three mudras. This is a Dhanu Mudra or a Ganu Mudra. When the palm is facing up, when the palm facing down, this is called a Chin Mudra. It opens the lower part of your lung. So do this mudra with the A. Close your fingers. This is called Chinmay Mudra. It opens the middle part of the lung. Then put your thumb inside and close your hand. Adhi Mudra. It opens the upper part of the lung. So let me show you one Pranava Pranayama, which is a centering pranayama. Then we'll do a very short centering meditation. Chin Mudra, palm facing down. Breathe out first. Take a deep breath in and breathe out with the sound of an ah. Chinmay Mudra. Breathe out with the sound of a oo. Adhi Mudra, breathe out sound of a ma. We continue this Pranava Pranayama for some time, maybe 5, 7, 10. But even before, even at the one Pranava Pranayama, you will see you enter into this transcendental state and centering. In a meditation, as I mentioned to you, you enter in the gap between the thought process. So the repeat thought process doesn't come. Like I have a repeat thought process this morning. I have to come, I have to talk to you, I have to talk to you about centering, yoga therapy. It's a constantly is your chattering your mind. When I'm in a meditative state now, I've been talking to you for so long, I have still, my mouth is wet. I have a parasympathetic activation. So in your meditative state or centering or connecting your body, mind, spirit, you will be able to access your subtle body. We have three bodies: gross body connected to your body, subtle body connected to your mind, causal body connected to your spirit. The subtle body is the body which you had been seeing for all of your life and an imprinted memory. So my eyes are closed. When I am in my center, I will be able to connect any part of the body without saying or opening my mind. Easily touch the tip of my nose, easily touch my right index finger, touch my left great toe, right great toe, but same way you'll be able to access your breath. So let's finish with a breath-centered meditation, and also with a breath-centered alternate nostril breathing without closing the nostril. Touch your index finger and thumb, put it both over your knees. You always breathe through your nostril. You never breathe through your mouth. Mouth is to talk and to eat. If you breathe through your mouth, you have no idea where the air is going. When you breathe through your nose, all the air is going to your lung. But if you at all has to breathe through your mouth, you can always breathe in through your nose, breathe out through your mouth. That is a lot more physiological. If you breathe through your mouth, you have no idea where the air has gone in. Close your eyes, keep your spine straight, Merudanda Achal and Manas Sthit. Visualize your breath. Visualize your breath outside your nose. Visualize your breath coming in through your nostril. Nose is your filter. Filters all the air coming from outside. Nose is also your personal air conditioner. Outside air is warm, it will cool it down. Outside air is cold, it will warm it up. Air goes into the side of the nostril called turbinate. Going through the turbinate, it creates a vortex. The vortex goes over the mucosa of your sinuses. Mucosa of the sinuses releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator. It dilates all the blood vessels, including coronary arteries. Nitric oxide brings your endothelial health. Endothelial health is as our health. Nitric oxide is also a mediator of your parasympathetic tone, like your acetylcholine, cyclic GMP. Air is going behind your throat, upper part of the lung, middle part of the lung, lower part of the lung. It's almost in the level of your belly button. Breath automatically gets stopped there. Like cable kumbhak. Visualize breath is coming out to the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. Outside the nostril, you have the prana. Prana is a subtle energy which keeps us awake, alive, and prana does all the healing for our body and mind. Call it pranic healing. In yoga therapy, our whole body does breathing, not only our lung. Skin is breathing, liver is breathing, kidneys are breathing. So visualize the prana to the organ of healing. So in your breath, picking up prana. Prana is not your breath. Metaphorically, prana is like electricity and breath is like an electric cable. Bring your prana inside through your nostril, behind your throat, into the lung, then take the prana to the organ of healing. I have a heart problem. I'm visualizing the prana in my heart causing pranic healing. If you have a back pain, visualize the prana going to your back and causing healing of your back pain. If you have diabetes, visualize prana coming to your pancreas. Pranic healing is the mental and spiritual healing. You will be doing all this with your eyes closed and in silence. I'm talking to guide you. Now you'll do a task which became almost impossible initially, but you'll be able to do it. You'll be doing an alternate nostril breathing without closing your nostril. This is definite centering and we call meditative pranayama. You'll be doing in silence. In a short time you'll see totally disconnected from outside and you'll be totally connected to your inner self. Visualize your breath. Visualize your breath coming out through your left nostril. Visualize breath is going in through your left nostril. Visualize breath is coming out through your right nostril. Visualize breath is coming in through your right nostril. Breath is coming out through your left nostril. Now in silence, keeping your spine straight, eyes closed, do the alternate nostril breathing without closing your nostril. Slowly bring your hand in front of your heart chakra, Anahata chakra. Touch your little finger and thumb, separate your index finger, middle finger and ring finger. Padma Mudra, Lotus Mudra. Connects your body, mind and spirit. Bring your Lotus Mudra to your heart. This pranayama practice, this meditative pranayama take you to the meditation. Balancing asanas, balancing pranayamas, centering meditative pranayama to meditation brings your yoga therapy, finding your center. This brings your mental and spiritual wellness to cause the complete healing of your underlying disease. Roger Chikitsha, treatment of the disease. That is called the Shasturokha, maintenance of your health. This maintenance of your health prevents the progression of your underlying chronic diseases, especially metabolic syndrome, diabetes, hypertension, coronary artery disease, dyslipidemia, trunk obesity. Slowly bring your hands in front of your heart chakra. Put your head down. In a yogic gesture, you say Namaste. Namaste means I honor the divinity with you. You are divine. This divine connection brings our health, healing, and wellness. Our path is already being set by the divine. So we follow that path. People ask me when we are going to meet in person. My simple answer is divine has already chosen our path and will connect when the time comes. Slowly open your eyes. Wonderful practice, wonderful experience. Please continue this practice at home and let me know if I could be of any help to you. And we'll continue our every Saturday morning classes. Even I am not completely cured from this laryngitis, but just to let you know, I have no other systemic symptoms, and all happened after my second booster shot of Pfizer COVID-19. So let me stop here and we'll see you again on next Saturday. Any questions, anything comes in your mind, please send me a message in the Facebook and I'll be glad to answer.